welcome to MRCPIOSCE OMR series, the series which we always do nearing your exams. Obviously, this series is quite famous because we always try doing the case discussions which are very important and which has appeared in your previous exams. So that's the reason this one is also would be similar to that, where today I would be doing a patient simulated task, and of course you keeping that time limit of 10 minutes as a short case, and we are going to show you actually towards the end of it the marking system and what are the common mistakes, do's and don'ts for the same task. Yes, of course, this MRCP OSCE exam is a very much doable. Remember, you are awesome, and always you should embrace your awesomeness, and remember, only you can believe in yourself much more than others, and this is very vital, especially during the exams. So let me start off with the task. So I'm just going to keep a timer, and yes, Stacy, if you can switch on your camera. Thank you, Stacy. Stacy is my role player and a fantastic one as well. So who would be able to help me to do this task better. So I'm keeping the time and we will start. Okay. Hello, I'm Dr. Sowmya, one of the doctors in the clinic. Can I confirm your name and age, please?
Hello, I'm Rebecca. I'm 34 years old.
Rebecca, thank you so much for confirming. So I can see that you have got the blood reports, and I'm aware that you are trying for the pregnancy. As we are meeting for the first time, is it okay if I ask you a couple of questions?
Yeah, that's fine.
Yeah. Please, can you tell me, like, from how long you have been trying and about, because I know you have been trying for a baby. So how long and what are the tests you have done so far?
Yeah, I have been trying for BB for last 1 year or so.
Okay. And I can see that you have got the blood test done and also the tubal test to be done, right?
Yeah. I'm really worried about the results.
Please don't worry. I would be able to help you in some time. Is it okay if I ask you a few questions before telling you the reports?
Yeah, that's fine.
Okay, fine. Thank you. And I can also see your partner reports is done, and probably you're aware as well. Now coming back to your periods. So can you tell me a little bit more about your periods?
Well, it's been quite irregular for the last 1 year or so. And my last period, I think it was 6 months back.
Okay. So before 1 year, it was normal, right? You used to get regularly the periods.
Yeah, it was quite normal, yeah.
Okay. And have you felt recently too much of heat and the hot flashes, or probably you feel little down or depressed, you feel tired? Have you come across any of such things?
Yeah, recently I've been feeling such.
Okay. Thank you for letting me know. And as well, I just want to know, are you allergic to any medications?
No.
Okay. And just to confirm, so you never had any pregnancies before, right?
No.
Okay. And are you generally fit and fine? Specifically, have you got any time, the long-term conditions like probably which can affect your body, we call autoimmune, anything like that you have been treated or you're on a long treatment for that?
No, nothing such.
Okay. Have you undergone any surgery or operation on your tummy or pelvis before?
No surgeries.
Okay. And just to confirm, like at your family, so when did your mother attain menopause, or are you aware of those details as well?
Yeah, I think my mother attained menopause at the age of 40, I guess.
Okay, fine. Thank you. And also, I just want to know, like, are you using any contraception right now?
No.
Okay. And few personal questions. Do you drink or smoke?
No.
Any recreational drugs?
No.
Fine. Thank you, Rebecca, for letting me know the information. I'll quickly recap whatever you said to me so far. So you're 34-year-old and you've been trying for pregnancy for last 1 year. And you have got a couple of tests and you are here to know the results as well. And also the periods have been erratic since last 6 months, and your last period was 6 months before. And you're not allergic to any medications and you're a little bothered by hot flushes and a little bit you're feeling down. And also,
Yeah, yeah.
your mom had attained menopause at the age of 40, correct? Anything else you want to add on if I have not asked you?
No, I'm just here to discuss my results.
Okay. Rebecca, thank you so much for giving all this information. So now I would like to discuss the results. Is there anybody who would
Yeah.
want to accompany you before I tell the results?
No, I'm fine.
Okay, do you want my nurse Sarah to sit with you? Because I'm going to give probably news which you didn't expect.
Um, no, it's fine. I can take it.
Okay. Rebecca, I'm really sorry I do not have great news. I'm afraid the results which are done, the blood which is taken is to check how well your ovaries are working. We have done tests twice, 4 weeks apart, and it shows that actually at the age of 34, your ovaries have stopped working. I'm really sorry.
What do you mean by okay? What do you mean by stopped walking?
That means to say that, like for generally for women, the ovaries would work up to the age of 51, 52, and once the ovaries stop working, that is when they attain menopause. The periods would be stopped and the egg release would be stopped, and also the fertility, like they cannot become pregnant. However, in your case, the ovaries have stopped working really early, which we call premature ovarian insufficiency. Are you with me, Rebecca?
Okay, so yeah, I get your point, but so what do I do next?
Rebecca, first of all, we have to see why this has happened to you. Okay, so we would be putting you in touch
Okay.
with a group of doctors and also we would be doing, including my consultant, and we have to run battery of tests to check why this happened earlier. Okay, starting from couple of tests, and also probably we need to check the genetic makeup, and also we will be checking your bone scan to see the strength of the bones as well. If we find a reason, then we would be able to treat that. However, majority of the time we won't be able to find a reason. But it's very important for you to understand what are your options, what are the options in front of you for the pregnancy. Okay. For 1 in 20 women, sometimes the eggs release spontaneously for a woman with this condition. And we don't know when this can happen. If that spontaneous egg release happens, if spontaneous ovulation happens, there is a possibility of natural conception. Okay. However, for majority of the women, what we advise as well, are they consider is as well the donor oocyte. Okay, where you can take an egg from somebody else and still can become pregnant. Okay, am I clear so far,
Yeah.
Rebecca?
Yeah, I understand your point. So
Okay.
does that mean I can't have my own children?
Rebecca, to be very honest, unless the spontaneous egg release happens in your case, you might not be able to, we might not be able to use your egg, but still your partner's sperm and the donor egg would be, we can take and still the baby would be yours. Of course, we can also think of surrogacy where somebody else carries your baby, but still you can, uh, you can have the baby after the delivery, which the legal and ethical issues we can discuss in the coming consultations. Okay. And also, some women in your place would choose adoption and fostering as options as well. Okay. I know there's a lot of information which I'm putting it across, and I would want to make sure that you're comfortable. And of course, I'm going to give a information leaflet later on so that you can have a look into that. Okay. And it, apart from the pregnancy part of it, we want to make sure that your heart is healthier and bones are stronger, and you are as healthy as you are now. Okay.
Okay. Yeah.
The reason being, the
So
because the ovaries have stopped working, the most important hormones like estrogen gets reduced. So we have to make sure that you are supplemented that with a hormone replacement therapy, which you need to be continuing till the age of 52. Okay?
Yeah.
Till the natural age of menopause. And at no point of time we would be giving contraceptive pills as HRT, because the chance of your egg release, the spontaneous egg release, we don't want that to be removed from the equation. Okay? So you would be given the proper hormone replacement therapy. Of course, we need to run a couple of tests before that. We need to check your bone scan. And of course, you will be followed up annually for the same. Okay? And as well, some women would actually have a lot of painful sex after this. So if that happens, we would be able to provide you the local hormonal cream to help you with that. Okay? And if you want any help with the counseling, or you want to speak to the people who have gone through your phase, we can put you in touch with the support groups and a counselor as well. Okay?
That was very helpful. Thank you.
Yeah. And so apart from this, I would also write a letter to your GP so that he would be informed in the loop as well. Okay?
Yeah.
Okay. Any questions for me, Rebecca?
Is there any particular reason why is this happening to me?
To be very honest, Rebecca, at this point of time, I cannot tell you why this has happened. As I said to you, we would be putting you in touch with a group of specialist doctors. We would be running the test, and we would be able to tell you, if at all, if we find out the reason. But the thing is, many of the times we might not find a reason. And I'm really sorry, this was not the thing which you expected in the consultation.
Yeah, it's okay.
Okay, so thank you, Rebecca. Thank you so much for meeting me, and I would be providing the leaflets and as well as the GP letter.
Yeah. Thank you.
Thank you. Okay. Yes, Shreyasi. So it is done. So I'm not sure. So how did you feel as a patient? Whether you would like to see me again as a doctor, and if there was something which
Yeah,
I
of
could
course.
improve on?
Yeah, of course I would see. I would like to see you. It was
Okay.
very good.
No, the thing is like whether the communication was easier for you, and whether I supported you enough, whether there was support, whether there was enough empathy, because that's important for the students who are watching this, because that's easier for them as well.
Yeah, it was all good. It was
Thank you.
quite supportive. Yeah.
Thank you, Shruti. Thank you so much, darling. Thank you for
Thank
being part of the
you.
YouTube series. Thank you so much. Take care. Thank you.
Thank you.
Yes.
Can I leave now?
Yes,
Okay.
please. Thank
Thank
you.
you.
Yes. So, guys, coming back to the marking system. Okay. So, just to give an overall view, you would always be marked on history taking, communication skills, how you're counseling, and the management part. So, I've given a panoramic view of what it is. Okay. Because in POI, you cannot miss the menstrual history. Obviously, you are supposed to be asking the past history, if at all, if she has got anything affected and things like that. Probably what I felt was I missed asking about the sexual history. I should have asked there, but I covered it towards the end of it by talking about the estrogen cream. But it's always a good idea to talk about them there. Communication skills, yes, you should always let the patient speak. Here, my patient was quite calm, and she was not very demanding. Most of the patients in MRCPIOSCE, they are not very angry, or they do understand. Even if they are angry or upset, with the proper communication skills, you would be able to do, like asking open-ended question and just checking their understanding. It's important. And empathy is very important, that I'm sorry, this must have been difficult for you, and obviously you have to give the information in chunks. And breaking bad news, that first of all you have to give a warning shot, offer support, give a warning shot, and immediately tell what the condition is. And explanation of the POI, it's important. Like I just said, ovary stopped working. She asked me what happened. Then I went to explain what happens in menopause, and she has gotten menopause early. I didn't tell that directly, but in an indirect way. So you can choose whichever the way you want, but it has to be without jargons. And of course, talking about the long-term health is very important. One is the fertility options, and also second is HRT. But before that, you need to really figure out the MDT part of it and why she has got. That's very important. And yes, you need to be talking to her about probably how she would be followed up as well. So I think I covered a lot of things, and these are the deducting marks. If you don't ask a menstrual history, or if you don't ask allergies or surgical history, there will be 1 mark would be deducted. Lacking empathy, it goes for the mark deduction. Did not check the understanding or offering insurance, reassurance, it would be again deducted. MDT involvement, you must make sure that you speak about it. Further investigations, which I mentioned to her about the genetic makeup, which is a karyotype, and management options. And of course, fertility options, what she has got. And also very, very important to continue the HRT. So guys, whenever you deal with a POI could be breaking bad news. Somebody comes with irregular periods and she has just come with POI. So you are supposed to be talking then also the MDT, what are the tests you are going to do, and again, the fertility and the long-term management. If somebody is coming for the fertility as well, you're going to speak about the same. Of course, make sure that you do not actually push her to a corner and be very direct, telling, okay, you have got premature ovarian failure. Failure and insufficiency are the words which you need to be careful about. So we would always say insufficiency because there is a 5% chance of ovulation. Okay, so guys, hope you like this task. Make sure to drop the feedback. We are happy to help, and I hope this would help to do this task better if you get in the exams. All the best, guys. May success be yours. Thank you so much.